All right. So, just having a little lunch, watching a little TV. While I eat my lunch, keep myself distracted. It's always fun. Keep seeing these medical commercials for different medications. There are several of them on. I guess they figure this is the time of day old people that need medication watch TV. So that's their target audience. I don't know. I don't know how that shit works or how they pick stuff. Not even important. Nothing to do with what I'm trying to say. So there was allergy medication. There's a dog on the rocks. He's around there. So again, allergy medication, right? So for people who have dry, itchy eyes, sneeze a lot, during allergy season, you can take this allergy medication for your dry, itchy eyes and your sneezing. Then they list the side effects. May cause dry, itchy eyes, uncontrollable sneezing, bone spurs, partial blindness, anal leakage. My fucking God. The side effects include the symptoms it's supposed to treat and has all kind of crazy extra shit that's way worse than having dry eyes and sneezing. Get some fucking eye drops. Boom. Why the fuck do they have all these medications that make shit worse? I mean, aren't they supposed to make you feel better? Isn't that kind of what medicine is for? So why with all these commercials does it make shit worse? There is another one for people with whatever the fuck they call that, hard breathing, the COPD shit. They say that this medication can help increase lung function as quickly as 5 minutes for people who have, chronic bronchitis or asthma and all this other stuff. Doesn't replace a rescue inhaler, so if you have an asthma attack, not good for that. And it may increase your chance of an asthma-related death. So the medicine that's supposed to make you better could fucking kill you. Cause like heart enlargement, fucking kidney failure. I mean, all this horrendous, horrifying shit. That, yeah, it sucks when you're having a hard time catching your breath, but I'd rather do that than have all these fucking extra side effects and the possibility of fucking dying from taking the stupid medicine. What the fuck is going on with medicine these days? They say, an ounce of prevention is worth a pound of cure, especially when the cure can fucking kill you. I mean, whose idea was that shit? Oh, I got a cat over there on my fence. That's Poof. Cutie likes to chase her. Where's Cutie? Oh, she's over there. You can't see her. But why are there so many medications that not only do the side effects include the symptoms that you're trying to get rid of, but just make shit worse, and they're trying to peddle this shit to us? It makes me feel like the medicine that we take is making us more sick. I don't know. I mean, is that a thing? Are they trying to fucking keep us dependent on medication? I try not to get political in my rantings. I certainly have political opinions, but I try to keep them to myself unless someone tries to shove theirs in my face. And I'm like, fuck you, here's mine. You open the floodgates, so this shit's on you. But why should our medication make us sicker? That doesn't make sense to me. That just seems dumb. It kind of goes against the whole reason you're taking the medication in the first place, is to get better. But now you get all these horrible side effects, and then you're going to need medication to get rid of those. Because now you got a large heart and kidney failure, and fucking your eyes are bleeding, and fucking your ass is leaking because you took some goddamn allergy medicine. Now you need more medicine for that shit. And it makes me worry Because with my fucked up back and the nerve damage in my leg, they give me a lot of fucking medication. It's mostly pain stuff, some muscle relaxers, some other stuff for nerve pain. And they've switched me around to a whole shitload of different. I've been on fucking morphine. I've been on OxyContin, MS-Contin, oxycodone, Vicodin, extra strength Vicodin, fucking methadone, Demerol, you name it, I've been on it. I'm lucky enough to not have a addictive chemistry. So even though I've been on fucking pain meds for 15 years, I'm not addicted to them. You know, it sounds like a contradiction. So how can you think you're not addicted to pain meds if you've been on them for 15 years? Well, I know, because I almost never take the fucking things. Because I hate them. I don't like taking them. So I don't take my medicine. I have a normal, like, shitty day about here where I'm at, you know, like about 7.5 or 8 on the, you know, 1 to 10 pain scale. 1 being like no pain whatsoever, 10 being worst fucking pain you can ever imagine. Normal for me is around between a 7 and an 8. Okay, so that's normal. That's a normal day. Those are the days I don't take any fucking pain meds. I might take an aspirin if I got a fucking headache. I get a lot of headaches. I know that's related to the fucking damage in my spine, because they travel just right up the fucking base of the skull and punch out through your eyeballs. So those are fun. But the most I'll take for that, you know, I have a couple extra strength Excedrin in the morning, or whatever the fuck, couple aspirin. But that's about it. So I've got like a 3-year stash worth of fucking all kinds of different fucking pain meds that I don't take. Now every couple of weeks, seems like at least every other week, if not a little more often, I have like a really fucking horrible day where I get up, jump up from like a 7 to about a 9. And when that happens, I'll take, I don't know, like 3 or 4 days worth of, of my pain meds. And that, unfortunately, with my body chemistry, all that does, it knocks me down, back down to, you know, a low 8, maybe a high 7. So my usual pain level just sort of brings me down a notch, just enough so I can sort of, kind of, maybe function a little bit normally. But, God, that cat hasn't fucking moved. You see that? She's still in the same goddamn place. Cats are fucking weird. What was I talking about? Oh. So, of course, the family's all concerned. Oh, you can't take, you're only supposed to take 30 milligrams of morphine once a day, not 120. That'll kill you. Ooh. No, it won't. Shit doesn't, the 30 doesn't do shit for me. That's why I don't take them. If they don't work, why take the shit? So, and I've talked with my doctor, and they've checked my liver and other organs functioning because of the way I take the medication when I actually take it. It's like, yeah, everything's working fine. If it works for you, you know, go for it. Doing a fucking whiz quiz every time I go in there. Because initially, when this whole shit first started, right, after my first couple of surgeries, they just had me on like the regular Vicodin. And it wasn't doing shit. I might as well have been eating Tic Tacs. So, call my doctor, say, hey, this shit ain't working. I need something stronger. So, he phones in. Oh, that's interesting. Sun's there. There we go. Some extra strength Vicodin. Call him up. Say, hey, this shit ain't working. I need something stronger. He says, well, I'll mail you out this prescription for this heavier medication that you actually need a handwritten. Can't call it in. That was, I think, the oxycodone. And that wasn't working. Called him up a day later and said, hey, this shit ain't working, need something stronger. So She says, you know, why don't you come on into the office and bring your prescriptions with you. Bring all the medication you got, and we'll talk about it. There's more cats. We have a lot of fucking cats. I hate cats. I really hate cats. That's Lump. Hi, Lump. How you doing, Lump? I don't like their snooty attitude. I'm a dog person. Son loves cats. Favorite thing in the fucking world. Dad's a big sap. So guess what? We've had up to 5 fucking cats at a time. We're down to 3. Lump's one of them. Poof, you saw. That's GK over there. Sunning themselves with their little kitty cat solar panels. Anyway, doctor calls me in. I go in, bring all my medication. I understand his concern. I'd been referred to him for pain management. Yeah, that's my cat's ass. Sorry. Jesus. So, he didn't really know me that well yet. Could be abusing the pills, could be selling them. He didn't know me. So I come in with all my medications, and he opens the bottles, and they're all full. And he's looking at me, he's like, did you even take any of these? I said, well, I took one, it didn't work, so I didn't take any more. Called you. And I guess some of them you have to take for extended periods of time, keep them in your system, blah, 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 blah. I don't work that way. I don't think that way. I try it, doesn't work, I'm not going to keep taking it. You know, I'm not going to take something that's going to be for pain in an hour or a day or a week from now, because I just won't take the fucking pills. I need something because if I'm taking the pills, it means my back hurts right the fuck now. So I need something that's going to work right the fuck now. If it's not working right now, why the fuck am I bothering taking this shit? I got really sidetracked. I was talking about commercials that irritate me. And they do. A lot of commercials irritate me. But the fucking medications, one of the medications I was on, I was actually reading the little, they give you that whole fucking paperwork on it and shit, tells you everything about the medication. And I can't remember which one it was, but this was kind of what started this whole rant for me. And it's way past due because this shit started earlier. But one of my medications, the little fucking information sheet, like a little MSDS for drugs, your material safety data sheet, said that doctors don't know how it works. It just does. They have no fucking clue. They don't know. They're giving me this shit. They don't know how it fucking works. They said, here, we found this stuff. Seems to work for pain. We don't know how. We don't know why. But here, eat it. If I was in a fucking restaurant and the chef came out, said, here, I made this. Don't really know what the fuck I put in it. Don't know where it came from. But it smells kind of good. You should eat it. I'd tell him to go fuck himself. I don't eat anything I don't recognize. If I gotta ask questions, fuck it, I pass. I guess I'm a fussy eater. George Carlin said it best. Fussy eater. Don't eat nothing that you don't recognize immediately. I didn't come to make inquiries. I came to goddamn eat. So give me a steak. I know where steak comes from. Give me some potatoes. I know where potatoes come from. Some gravy. That's just steak juice, basically, and a little flour. Right? Know where gravy comes from? Comes from the gravy tree. She doesn't even know what she's barking at. You know what you're barking at? Do you? Come here. Come here, my little cutes. Come here, little baby. Come here. Look. Look at this cute puppy. Look at how cute this puppy is. See that? That is a cute little puppy who needs a haircut badly. Yes, she does. My baby needs a haircut. My little baby needs a haircut, huh? Anyway. Oh. I'm sorry. Was I not done petting you? I'm sorry. She likes to be on camera. She doesn't like to be on camera. She doesn't know what she wants. She's a girl, so, can't make up her mind. And that's okay. This is a really long fucking video, and I'm rambling a lot, and I'm sorry. Not really. No, not even a little bit. It's a nice day out, and I had some crazy shit in my mind. Like allergy medicine that causes anal leakage. What the fuck is up with that? Anal leakage? Seriously? You'll stop sneezing? Well, you won't, because one of the side effects was sneezing. And now you're just going to walk around just shitting yourself. But it's okay. It's not just going to be a full-blown it's just going to leak. Just kind of bloop, 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 bloop. So it'll be less noticeable, except to the people behind you. Alright. I'm tired of being out in nature. I'm starting to hear, like, people moving around. Nature. It's my backyard. Not exactly called nature. But I have trees. See my tree? That's the one I got, like, hatchets and knives and shit stuck in. I was juggling hatchets. Not my finest hour. But it did keep me entertained for a while. I would have filmed it, but I needed both hands to throw the hatchets. And I was home alone. That's usually when I do stupid shit. So anyway, I'm going to go inside. Because there's cats out here. What the fuck was I even talking about? Not important. See ya.